If you are over 60, the way you sleep at night may be affecting your brain and heart more than you realize. Doctors say one very common sleeping position can quietly increase stroke risk during the night. This does not mean you should panic. It simply means understanding your body better can help you protect your health in a very simple way. Why sleep habits matter more after 60. As we age, our bodies become more sensitive to small daily habits. After 60, blood vessels are not as flexible as they once were, blood pressure can fluctuate more easily, and circulation becomes slightly slower during rest. Sleep is the time when the brain and heart recover, but the wrong sleeping position can interfere with this natural repair process. What felt comfortable in your 40s may not be safe in your 60s. The sleeping position doctors are concerned about. Many doctors warn seniors about sleeping flat on the back with the head pushed forward or twisted to one side for long hours. This position is extremely common, especially among people who use thick pillows or fall asleep watching television. While it may feel relaxing, this posture can place pressure on the neck, restrict blood flow, and interfere with oxygen supply to the brain during the night. How neck position affects blood flow to the brain. Inside the neck are important arteries that supply blood to the brain. When the neck is bent forward, twisted sharply, or compressed for several hours, these arteries may not function as efficiently. Doctors explain that reduced blood flow during sleep can increase the risk of clot formation, especially in seniors who already have high blood pressure, diabetes, or cholesterol issues. Why stroke risk can increase overnight. Strokes often occur in the early morning hours. This is because blood pressure naturally changes during sleep, and dehydration is more common overnight. When poor sleeping posture is added to these factors, the risk can quietly increase. Doctors emphasize that this does not cause a stroke by itself, but it can contribute to the overall risk in vulnerable seniors. Why seniors often choose this position without realizing the risk. Most seniors choose this sleeping position simply because it feels familiar and easy. Back sleeping with a high pillow may reduce snoring or back discomfort in the short term. Unfortunately, comfort does not always mean safety. Many people are unaware that posture during sleep matters just as much as posture during the day. Common morning signs linked to poor sleeping position. Doctors suggest paying attention to how you feel when you wake up. Warning signs may include morning headaches, neck stiffness, dizziness, numbness in one arm, or a heavy feeling in the head. These symptoms do not automatically mean something serious, but they can indicate reduced circulation during sleep and should not be ignored. Why this issue is more serious after age 60. Younger bodies can often compensate for poor posture. Senior bodies cannot always do this as easily. Blood vessels become narrower with age, and recovery takes longer. That is why doctors are more cautious when advising seniors about sleep posture, especially those with heart conditions or a history of mini strokes. What doctors recommend instead: safer sleep position. Most doctors recommend side sleeping with proper support for seniors. Sleeping on the side helps keep the airway open and allows more natural blood flow to the brain. The neck remains in a neutral position, reducing pressure on arteries. This position is considered safer for both heart and brain health when done correctly. How to sleep on your side the right way. Side sleeping works best when the spine stays straight. Doctors suggest using a medium-height pillow that keeps the head level with the body. Placing a pillow between the knees can also reduce pressure on the lower back and hips. Small adjustments like these can significantly improve circulation during the night. The role of pillows in stroke prevention. Pillows play a much bigger role than most people think. Very high or very soft pillows can bend the neck unnaturally for hours. Doctors often recommend replacing old pillows every 18 to 24 months. A supportive pillow that keeps the neck aligned can reduce unnecessary pressure on blood vessels while sleeping. What about seniors who can only sleep on their back? Some seniors have medical conditions that make side sleeping difficult. In such cases, doctors recommend using a thinner pillow and keeping the head aligned, not pushed forward. Elevating the upper body slightly rather than bending the neck can also help reduce pressure and improve breathing and circulation. How other night habits add to stroke risk. Sleeping position is important, but it is not the only factor. Heavy meals before bed, dehydration, alcohol consumption, and irregular sleep schedules can all increase nighttime stroke risk. Doctors stress that improving sleep posture works best when combined with healthier evening habits. The importance of staying hydrated before sleep. Dehydration thickens the blood, making clot formation more likely. Seniors often avoid drinking water at night to prevent bathroom trips, but doctors recommend small sips of water before bed to maintain healthy circulation. Proper hydration supports the brain and heart throughout the night. Why calm, consistent sleep is protective for the brain. Quality sleep allows the brain to regulate blood pressure and repair blood vessels. Irregular sleep patterns, stress, and discomfort interrupt this process. By choosing a safer sleeping position and creating a calm bedtime routine, seniors can lower stress on the cardiovascular system naturally. When to talk to a doctor about sleep and stroke risk. If you experience frequent morning headaches, unexplained dizziness, or numbness, it is important to discuss sleep habits with your doctor. They may recommend changes in posture, pillow type, or further evaluation. Early awareness can prevent future problems. Small changes that make a big difference over time. Doctors emphasize that stroke prevention is not about fear but about small daily improvements. Changing sleeping position, improving posture, and supporting the neck properly may seem minor, but over months and years, these changes can protect brain health and improve sleep quality. A gentle reminder for seniors watching this video. Growing older does not mean becoming helpless. It means becoming more aware. Your body still responds positively to gentle care and smart habits. Protecting your sleep posture is one simple way to support your heart and brain without medication or stress. If this information felt helpful or relatable, consider subscribing to the channel for calm, practical health guidance designed especially for people over 60. You can also share in the comments how you usually sleep at night. Sometimes, awareness is the first step toward better health.